Welcome to Study Session 9, Assessment in Clinical Psychology. Introduction. Having discussed classification and diagnosis in clinical psychology in the previous study session, we will therefore in this study session be introduced to clinical assessment, steps involved in clinical assessment, the clinical interview, explains the different types of clinical interview, the factors affecting effective interviewing. Learning outcomes. At the end of this lecture, you should be able to 1. Define clinical assessment. 2. Explain the clinical interview and state how it differs from regular conversations. 3. Discuss the different types of clinical interview. 4. Enumerate the uses and factors affecting effective interviewing. Clinical assessment. Assessment involves the appraisal of individuals as a basis for decision making. Clinical assessment is a systematic evaluation and measurement of psychological, biological, and social factors in a person presenting with a possible psychological disorder. Psychological assessment entails the gathering and integration of various types of data from multiple sources and perspectives. At a minimum, this involves information provided by the client and information based on the psychologist's observation of the client during a clinical interview. The term assessment incorporates a wide variety of activities, ranging from descriptive assessment, which describes the symptoms of a client or an aid to diagnosis, to functional assessment, which determines the situational and behavioral features that serve to maintain maladaptive behavior, to prescriptive assessment that prescribes types of interventions that are most likely to be beneficial. The assessment process is systematic and as such goes through some orderly steps. The uses of a diagnostic system. First step. This step requires the psychologist to formulate some questions addressing the purpose for referral or request for assistance made by either an individual or by significant others such as parents, physician, religious leader, or teacher on behalf of the individual. Second step. In this step, a psychologist determines what he or she hopes to accomplish during the assessment process in order to decide on the type of information that will be relevant. Third step. The third step entails the identifying the standards by which the collected information will be interpreted. Fourth step. The actual collection of the relevant information is the fourth step in the assessment process, which involves the collection of information regarding the individual, his or her environment, and a detailed description of the individual's behavior and appearance. Clinical interview is almost always one component of data collection and may include specialized form of interview known as mental status examination. Step 5. Decision making and judgment based on the collected data is the fifth step in the assessment process. When decision making is based on research-based formula to diagnose, classify, or predict behavior, then the psychologist is using actuarial judgment. Structured interview schedules, observation, behavioral assessment, and psychological testing also provide information relevant to assessment. It should be noted, however, that sometimes clinicians base their judgment on intuition, in which case the psychologist may intuitively sense that a patient is suicidal and make decisions based on this, though the patient does not exhibit any of the research-based characteristics suggestive of his or her intuition. In this case, he or she is using clinical judgment. Although actuarial judgment is usually superior, clinical psychologists still rely heavily on clinical judgment. Finally, the psychologist must communicate his or her opinion, judgments, and decisions to significant others, either verbally or in form of psychological assessment report. How clinical interview differs from regular conversations. Interview has been defined as a form of conversation wherein two people or more people engage in verbal and non-verbal interaction for the purpose of accomplishing a previously defined goal. Maccabee, 1954, are more specific about the kind of interaction when they define the interview as a face-to-face verbal interchange in which one person, the interviewer, attempts to elicit information or expressions of opinion or belief from another person. In the interview, the verbal expression of the respondent must be directed towards interviewer in response to the interviewer's questions or comments. Kahn and Cannell, 1958, see the interview as necessarily being restricted in scope and focused on some specific content area, with consequent elimination of extraneous material. They see the important feature of the interview as a pattern of interaction in which the role relationship of interviewer and respondent is highly specialized. A clinical interview is a dialogue between psychologist and patient that is designed to help the psychologist diagnose and plan treatment for the patient. It is often called a conversation with a purpose. The various definitions considered together cover the main features of the clinical interview, which are: A, that it must be a face-to-face meeting between two or more people that must be able to see, hear, and understand each other. B, that it must be conducted for some specific purpose which is known by the interviewer and usually by the client as well. C, that the range of topics for discussion is deliberately restricted and controlled by the interviewer, who attempts to elicit information or expressions of opinion from the client. D, that specific roles are adopted by both interviewer and client. It is, however, vital to note that an interview for the clinical psychologist is not a cross-examination, but rather an opportunity for the clinical psychologist to be attentive to the client's body language, such as facial expression, making of eye contact, body postures and gestures, as well as how the client says what he says in response to questions such as the pitch of voice, rate of speech, and stuttering. Also, interview is not often exclusively used as a method of assessment, but rather it is employed in conjunction with a number of other methods of assessment, such as projective and non-projective tests, which we discussed in study session 10. It, however, provides the necessary background upon which the decision to have further psychological assessment is based. There are several key differences between a conversation with a friend and a clinical interview. Types of interview. The clinical psychologist conducts various types of interviews. The purpose of the interview determines the type to be adopted. Some of the available types of interviews are: 1. The intake interview. 2. The case history interview. 3. Structured interview. 4. Mental status examination interview. 5. The crisis interview. 6. Diagnostic interview. 1. The intake interview. The intake interview, otherwise called the admission or point of entry interview, is conducted at the first contact with the client. It aims to have a better insight into the client's presenting problems by attempting an appraisal of the patient's circumstances as efficiently as possible, so as to decide on the most suitable mode of intervention. Primarily, the interviewer is interested in identifying the exact reason for the client-patient seeking help, the type of help that is desired, and if the help had been sorted from somewhere else before coming. Though the intake interview is often short, it is particularly vital in offering the right kind of help to the potential client or patient. Some patients may desire or be in need of interventions which the particular clinic they have visited may not be equipped to give. The intake interview thus enables the interviewer to quickly determine and give appropriate referral as soon as it is discovered that a client cannot be helped where he or she has sought help, thus saving everyone's time, including that of the client. It should be noted that every patient will not be able to state coherently what the nature of his trouble may be. Moreover, there may be other non-verbal details which the interviewer might observe and record that could be helpful later during intervention. No gainsaying that a poorly conducted intake interview would be expensive in terms of time spent on treatment, while a well-conducted intake interview could save time. 2. Case history interview. Immediately after the intake interview, the interviewer checks the social personal history of the client or patient. A typical case history interview seeks information on client's name, address, date of birth, early life, nature of family relationships, and physical environment of upbringing. His or her educational and vocational history, medical history, drug taking history, as well as other details. Information is obtained not just from the patient, but also from members of patient's social network. Information from significant others such as family members, friends, neighbors, and others is necessary because in most cases, the patient is unable to concisely and accurately communicate the necessary social and personal information. This will be needed to get a full understanding of the origin of the client's problems as well as the factors maintaining the problems. Moreover, it also serves as a check and balance in case the patient or client is a less than truthful information. The primary aim of conducting the case history interview is to get ample information that will aid in making accurate diagnosis and in the design of an appropriate intervention to help client or patient. 3. Structured interview schedules. In an attempt to increase the reliability and validity of clinical interviews, a number of structured interviews have been developed. These interviews include very specific questions asked in a detailed flowchart format, such that if a patient answers yes to particular questions, for example, about OCD, obsessive compulsive disorder, a list of additional questions might be asked to obtain details and clarification. One of the most popular structured clinical interviews is the structured clinical interview for DSM disorder. Structured clinical interviews contain standardized questions to ensure that each patient is interviewed in the same way. These questions usually ask about the nature, severity, and duration of symptoms. The goal is to obtain necessary information to make an appropriate diagnosis, to determine whether a patient is appropriate for a specific treatment or research program, and to secure critical data that are needed for patient care. The advantage of this approach is that variations between interviewers are minimized, which tends to improve the reliability of the interview. The most significant weakness, however, is that the approach lacks efficiency as the process takes substantially longer time than the traditional diagnostic interview, and patients often end up responding to questions for which the answers are almost foregone conclusions. Also, the lack of flexibility may cause the interviewer to overlook promising avenues of inquiry not covered in the schedule. 4. Mental status examination interview. A mental status examination (MSE) interview is a semi-structured interview often conducted to assess the client's level of emotional and mental functioning. The typical MSE interview comprises a brief observation and evaluation of the patient's appearance and behavior in the interview, speech characteristics, mood, thought processes, insight, judgment, attention, concentration, memory, and orientation. Outcome of client's mental status examination often provides the initial data on the probable psychiatric diagnosis as well as offering some suggestions for additional appraisal and possible intervention. For instance, mental status interviews typically include questions and tasks to verify clients' orientations in time. For example, what is today's date? What day of the week is today? Place, for example, where are you? What is the name of the hospital you are in? And person, who am I? Who are you? Also, the NSE assesses long, intermediate, and short-term memory. For example, where did you attend primary school? What did you have for dinner? I am going to name 3 places, and I'd like you to repeat them in the same order: Lagos, Calabar, and Belgium. And concentration. For example, count backwards in 5s from 100. During the examination, the interviewer notes any unusual behavior or answers to questions that might be indicative of a psychiatric disturbance. While the MSE is often a useful assessment tool, it can be subject to bias as it is based on the interviewer's clinical judgment during evaluation. 5. Crisis interview. A crisis interview occurs when the patient is in the middle of a significant and often traumatic or life-threatening crisis. The psychologist or the mental health professionals might encounter such a situation while working at a suicide or poison control hotline, an emergency room, a community mental health clinic, a student health service on campus, or in many other settings. The nature of the emergency dictates a rapid, get-to-the-point style of interview, as well as quick decision making in the context of a calming style. For example, it may be critical to determine whether the person is at significant risk of hurting him or herself or others, or it may be important to determine whether the alcohol, drugs, or any other substances are used, so as to make sure that the clinician interviews the person in a calming and clear-headed manner, while asking critical questions in order to deal with the situation effectively. The interviewer may need to be more directive. For example, encouraging the person to phone the police, unload a gun, provide instructions to induce vomiting, or step away from a tall building or bridge. Break confidentiality if the person is in serious and immediate danger, or enlist the help of others. For example, police department, ambulance. 6. The diagnostic interview. The purpose of the screening or diagnostic interview is to assist the clinician in his attempt to understand the patient. If the level of diagnostic understanding required is merely a separation of the fit from the unfit, as in military neuropsychiatric examinations, the interview task is one of screening. That is, after a brief interview, the interviewee could be adjudged fit for specific duties such as a regular military assignment, or it may be referred for prolonged observation and extended psychological testing. Occasionally, limit or trial duty may be recommended as an alternative to regular duty of psychological observation. Upon other occasions, the diagnostic task is highly specific and a detailed level of understanding is required. This may involve a diagnostic label as categorized as paranoid schizophrenia and a description of personality dynamics. In this latter case, primary dependence is not placed upon the interview alone, for psychological tests play a most important role in such detailed diagnostic procedures. In the diagnostic interview, while the examination progresses, the interviewer observes the interviewee's behavior as well as noticing the content of his answers. An observation of a client's thighs pressed together, a missing walk, a fluttering feminine gesture in a male should lead the interviewer to suspect and investigate the possibility of homosexuality. The bubbling, enthusiastic replies and exaggerated gestures in another interviewee should lead the interviewer to hypothesize tentatively a manic condition and seek further evidence. Thus, this kind of interview is used to ascertain whether an individual needs help or not. Uses and factors affecting effective interviewing. Interviews are the most common and inexpensive strategy for gathering information that cannot be easily assessed in psychometric tests, but which are undoubtedly important in case formulation, problem definition, goal setting, and making of diagnosis. Apart from being a source of invaluable information to the psychologist, the clinical interview also serves as a tool for developing rapport and a sense of collaboration between the client and the psychologist in the process of resolving the challenge that has brought the client to the psychologist. The uses of the clinical interview may be classified under three headings, which are: A. Fact-finding, B. Diagnostic personality assessment, C. Therapeutic. Any such classification is bound to be artificial since each category overlaps the other two. Any interview tends to be therapeutic in the sense that the client may benefit in some way from his encounter with the interviewer. Diagnostic and personality assessment interviews involve a great deal of fact-finding, and fact-finding interviews yield pointers to diagnosis and personality. However, the classification is probably useful as it defines the goal of the interview in question. The fact-finding interview is designed to elicit matters of fact rather than of opinion. This information is something the client possesses and which need not be about him or concern him directly. The diagnostic and personality assessment interview is usually directed to eliciting data from and about the client himself. The therapeutic interview seeks to change the client in some way, to modify his attitudes, opinions, and behavior, rather than just to learn about him. In practice, the clinical interview may be partly fact-finding, will certainly be diagnostic, and may prove to be therapeutic as well. Factors affecting interviews. Whether the outcome of an interview will be useful or otherwise is often determined by various factors. These factors could range from the physical setting of the interview to the lack of the adequate skills on the part of the interviewer or the lack of willingness to cooperate on the part of the client. Some of the factors that could affect the outcome of an interview are discussed below. 1. Physical setting. 2. Note-taking and recording. 3. Rapport. 1. The physical setting. An interview should be conducted in a neat, comfortable, and well-ventilated environment. The physical setting should be such that absolute privacy is ensured without the fear of an uninvited third party listening in on the conversation. There should also be freedom from interruption due to unnecessary noise or people moving in and out of the office that could interfere with the flow of thought and communication. 2. Note-taking and recording. While a detailed documentation of all contacts with the client is part of the job of the clinical psychologist, care must be taken in ensuring that note-taking during sessions does not adversely affect the interview process. A clinical psychologist may take a few notes to aid memory when writing the detailed report, but should avoid the temptation to act as a secretary by attempting to capture verbatim all that the client is saying. Such an attempt is likely to distract the clinical psychologist from fully grasping the meaning behind what is being said, as well as how it is being said, as he or she will miss the opportunity of observing and noting the patient's body language. To overcome some of these shortcomings, the clinical psychologist may opt for the option of audio or videotaping the interview after obtaining the prior permission of the patient to do so. Issues related to how interview should be documented should be discussed even before commencing the interview. 3. Rapport. Rapport describes the quality of patient-clinician relationship. Good rapport is inevitable if the purpose of the interview is to be achieved. No worthwhile result can be expected in a situation of mistrust and unclear understanding of the rationale of the interview. The interviewer's professional skills will have an excellent opportunity to be effectively harnessed in helping the client only if the interviewer is able to establish a relationship with the client based on mutual respect, trust, and a clear understanding of the purpose of the interview. 1. Tact. The client should not be rushed into giving answers to questions, neither should the clinical psychologist be too eager to supply or suggest answers for a client. There is a need to be tactful in determining how long a pause should be allowed for a client to reflect on his or her responses to questions. This is to avoid a situation where the pause becomes so extended as to make both parties, especially the client, ill at ease. Also, the clinical psychologist should watch out for the possibility of excessive emotional expression and tactfully put this under check before it gets out of hand. 2. Reliability and validity of interview method. Reliability and validity may also be threatened. For example, if 2 or more interviewers conduct independent interviews with a patient, they may or may not end up with same diagnosis, hypothesis, and treatment plan. Furthermore, patients may not report the same information when questioned by several different interviews. Interviewer, gender, race, age, and skill level are some of the factors that may affect patient response during an interview. Emotional level may also have an impact on reporting of information. For example, personal questions regarding sexual behavior, alcohol use, child abuse, or other sensitive issues may elicit varying responses from patients under different circumstances. Reliability and validity may be enhanced by using structured interviews, asking similar questions in different ways, using multiple interviewers, and supplementing interview information from other sources. For example, medical records, observers, questionnaires. Summary of study session. In this study session, you have learned that 1. Clinical assessment is the systematic evaluation and measurement of psychological, biological, and social factors in a person presenting with a possible psychological disorder. 2. Clinical interview is a highly purposeful exercise that takes place within a predetermined time frame with specific roles being adopted by both interviewer and client. 3. Different types of interviews such as the intake, crisis, structured, case history, diagnostic, and mental status examination interviews. 4. Factors that could affect the outcome of a clinical interview include physical setting, note-taking, rapport, tact, interviewer's bias, as well as the reliability and validity of the interview method. This is the end of study session 9. Thanks for listening.